Welcome to the 2017 update for the Chronic Fatigue, Fibromyalgia, and Autoimmune Clinic of Michigan. There is a tremendous amount of hope and many new things to talk about in this updated edition. So let's get started. First, however, remember that the information that I'm reviewing today is for informational purposes only. Obviously, I do not know your specific case. Therefore, never begin or end any medication or treatment without discussing it with your personal physician. And never begin any of the treatments and or herbs or supplements I talk about in this video without directly consulting either with us or with a physician that understands holistic therapy. So let's get started. First of all, as I mentioned, we have to say that there is a tremendous amount of hope. In 2016, we have seen hundreds of people, and we've been able to help them by revitalizing their energy, reducing their pain in fibromyalgia, and reducing the inflammation and the destruction of autoimmune disease. Many of these patients have been severely damaged, and some of them are still able to work, but barely. And we have seen patients from all over the world, as far away as South Africa, India, Germany, and elsewhere throughout the world, including hundreds of people from the United States of America and Canada. One of the contributing factors that we work on in chronic fatigue syndrome is mitochondrial dysfunction. Mitochondria are your energy power plants inside of your cells. They convert your food to energy. The better you do this, the more energy you have. The more damage to those mitochondria, the less energy you have for everything, because they control your immunity, your energy, your brain function, and even taking waste products out of cells and nutrients into cells. Many people, indeed most people, with chronic fatigue or fibromyalgia and autoimmune that we see have damage, premature damage to the mitochondria, which are inside of every cell. This damage can come for many reasons. One is from nutritional deficiency. The mitochondria require many nutrients to help it in those steps in converting food to energy. And we actually have studies, which we'll talk about, that can help us to determine what are the nutrients you're deficient in and how we can improve mitochondrial function. This is something I've been doing for 30 years, both in Olympic athletes and now in people with chronic fatigue syndrome and fibromyalgia. Other things that can damage the mitochondria are heavy metals such as lead, mercury, and others, arsenic, pesticides. That's how pesticides kill pests. They either damage the nervous system or they damage the energy system, that mitochondria. Herbicides and other chemicals, volatile organic compounds, if you get a high enough dose, can severely damage the nerves and the mitochondria. So there are toxic problems. You can get problems through oxidative damage. Many of our patients are damaging themselves at an increased rate because of inflammation. We work to restore the antioxidants within that mitochondria to help protect it from damage and to actually improve how the mitochondria makes its energy. Kind of like having enough motor oil inside your engine. If you do not have enough motor oil, the damage from the friction of the engine just producing energy will cause horrible damage to your engine. It's more complex from that, but that's not a bad analogy. And of course, infection can damage mitochondrial function. viral infections, which we'll talk about, fungal infections, and some bacterial infections, which we'll discuss a little bit later in this video. There are actual tests that are not well understood by almost all physicians, but there are tests that can tell us how well or how poorly you're making your energy inside that mitochondria. And then I can use my 30 years of experience to prescribe a treatment program to help restore the nutrients and antioxidants you need to function better. And of course, we work on infections and we try and reduce toxins. It's actually a urine test. It's not perfect, but it's still the best thing we have for determining energy production inside the mitochondria. There are numerous treatments, which we'll talk about at the end of this video, to try and upregulate or improve your mitochondrial function, and those are vital. Again, they are something that are advancing all the time because of both our research here and my 30 years of work, but also because we now understand that mitochondrial damage is the cause of aging, certainly a primary cause of aging, and with millions of baby boomers now getting to that age, the research on the mitochondria, thank goodness, has increased dramatically. And we use that research to help people with chronic fatigue and fibro. Of course, infections, as I mentioned earlier, can affect energy production and contribute to chronic fatigue syndrome, fibromyalgia, and even autoimmune diseases. Some of those viral infections most of you are aware of, things like Epstein-Barr virus, cytomegalovirus, human herpes type virus 6. There are also viruses, however, and bacteria that you may not be so aware of. Bacterial infections, such as mycoplasmal, chlamydia pneumonia, chronic strep infections, and there are parasitic infections, which can dramatically alter your immunity, alter your energy production, and we have found more parasitic infections with a new special type of parasite stool that we are doing. We've found more parasite infections in the last 3 or 4 years than I found in my first 25 years as a doctor. And for any of you watching who have irritable bowel syndrome, you must get this advanced parasite study done, because we find people all the time with worms or giardia or other parasites that when we treat them, it's not a magic cure, but it's part of them improving their chronic fatigue. And they certainly won't get better without that treatment. And by the way, those of you who've been diagnosed with ulcerative colitis, Crohn's disease, or non-specific colitis, you must have this specialized parasite studies that I will talk about a little bit later in this video. It is of paramount importance. Just in the last year, we've found several people who've been diagnosed with Crohn's disease all of their life who actually had parasites. And while I cannot say they don't have Crohn's disease, when we treated the parasites, they have dramatically improved. Some of the things that can add to viral infections, and one of the things that we work on is immunity. We do natural killer cell functional activity levels. Do you know what your natural killer cell function level is? If you have chronic fatigue and fibro, you must know that number. Now, unfortunately, if you go to your doctor and you tell them I want a natural killer cell function, he or she will do the numbers, maybe, but they won't do the function. The function is a specialized test that tells us how well or how poorly your immune cells are moving, and have been shown to be one of the precursors. Matter of fact, I did some of the first research on this back in the late 80s that associated low natural killer cell function with severity of chronic fatigue syndrome. It feels like a normal blood test for you, but of course there are specialized technologies that have to be done by the lab. Everyone should have a natural killer cell function done if you have chronic fatigue and fibro. If you have autoimmune disease, we already assume that your natural killer cell function is actually high, and we have to lower it, which we can talk about in a little bit. We also look at IgG subclass deficiencies. IgG is the immune globulin G and is very important in our ability to fight off infection. And many of our patients have deficiencies in the subclasses of IgG. Again, for you, it feels like a normal blood draw, but a doctor has to know what they're looking for. And the cool thing about this is that if you have IgG deficiency, there's actually a natural treatment which can help improve your IgG levels. There is IVIG, which in severe cases some doctors use, but I do not, because it's a human product. It can be associated with significant side effects. It's IV, it's costly, and therefore there is actually a non-human supplement that can improve immune globulin if you have immune globulin deficiency. It is important to remember that there are a number of studies available for viral or bacterial or parasitic diseases. There's viral titers. There is what's called PCR, polymerase chain reaction, which is a DNA study to see if you have active virus in your blood. There are, of course, blood studies for antibodies for mycoplasma and chlamydia and strep. And of course, there's other viruses such as the parvovirus and numerous others that can contribute or cause chronic fatigue syndrome. In addition, we looked for other infections, of course, such as Lyme disease, Borrelia, or its associated diseases. And now there is even a virus associated with tick bites that we watch for in those people who either have had positive viral titers, or positive titers to Lyme, or have had family members, dogs or cats, who've had Lyme disease, so we know that Lyme is in their area. A third area that we have focused in on a lot since the last update is rehabilitation of your bowel. I already mentioned that we have found more parasites than ever before, indeed ever in the history of my experience, which is 30 years. And that is vital for you recovering your health. Millions of Americans travel to third world countries. We see people who've been to Mexico, China, Thailand, India. We could go on and on. Millions of Americans do trips for great causes, such as the Peace Corps, or religious trips, where they go into indigent populations. But of course, 95% of the third world countries, the people have parasites. And then many people just go on vacation, millions of people. And that is not even to mention all the legal and illegal immigrants that we have coming into the country. And of course, going to school with your children, who can pick up parasites from them if they don't wash their hands properly after having a bowel movement. Or with the one of the first jobs that they get is in food preparation. And if they don't wash their hands properly and they touch your food without gloves, they can spread parasites. I just read an amazing article that said that Giardia cysts, Giardia is a parasite that can cause tremendous problems, can live outside the body for up to 3 years. It's amazing. So we do a lot of work with parasites. We do a tremendous amount of work with Candida, because Candida overgrowth increases inflammation, those pro-inflammatory cytokines, which are going to aid in fibromyalgia, an autoimmune disease. Candida also damages the mitochondria membrane where the energy production takes place. Millions of you have had antibiotics all your life, as a child for ear infections, as a young adult for throat infections, or for years for acne, as an adult for urinary tract infections, vaginal infections, bronchitis, sinusitis. All of that can lead to yeast overgrowth, and the yeast overgrowth increases